Without a doubt, this is the third wave doctors were warning about.
With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper.
Experts say Canada is one of the few countries with major variants rapidly spreading at the same time. While the U.S. doesn't screen as much, it has a much larger population. Still, Canada's tracking similar case numbers of the B117 variant first identified in the U.K. and the one in South Africa. This country's also found nearly 3 times the number of P1 cases first seen in Brazil.
If it continues at the rate it is, then I think we're going to have a tough summer.
Doctors in intensive care units say the original coronavirus, known as the wild type, is disappearing. They're now dealing with a whole new pandemic.
We now have to isolate our patients until we know whether or not they are wild type, B117, or the P1 variant, because mixing them can cause reinfections and secondary contamination and outbreaks in our hospitals.
While the more contagious B117 variant is now surging in most provinces, BC, Alberta, and Ontario are also confronting the P1 variant. Not only has it led to reinfections in Brazil, but research suggests there's been a sudden rise in COVID-19 case fatality among young and middle-aged adults in southern Brazil after the P1 variant was identified. This study isn't peer-reviewed yet, and while the death rate remains low, researchers say for patients aged 20 to 29, fatality rates tripled and similarly doubled for middle-aged adults.
I'm just crossing my fingers and hoping that we will get everybody vaccinated before we see the combinations of mutations.
There's no evidence so far suggesting any of these variants can fully get around current vaccines, but doctors insist provinces need more severe lockdowns like the ones we saw last year in order to get this surge under control. Christine Burak, CBC News, Toronto.